What are long-term antibiotic side effects for diverticulitis? Imagine taking antibiotics to fight off an infection, but then realizing that long after the treatment ends, some effects still linger. That's often the case with antibiotics used for diverticulitis, which is an inflammation or infection of small pouches in the colon called diverticula. While antibiotics are essential for treating acute episodes, their long-term use can lead to some important side effects that everyone should be aware of. One major concern is how antibiotics can change the balance of bacteria in your gut. Your digestive system is home to beneficial bacteria that help you digest food and support your immune system. When antibiotics are used over a long period, they can wipe out these good bacteria, leading to an imbalance. This disruption may last 4 months or even longer, making it harder for your gut to recover. Such changes can impair digestion and immune responses, and may even increase the chances of developing more diverticulitis episodes or other digestive issues in the future. Another point to consider is that long-term antibiotic use does not necessarily prevent the return of diverticulitis. Some studies suggest that repeated courses of antibiotics do not significantly lower the risk of future episodes. In fact, disturbing the gut flora repeatedly might make the gut more vulnerable to inflammation or infection again. There is also the risk of developing antibiotic resistance. When bacteria are exposed to antibiotics over and over, some may adapt and become resistant. This means that future infections could become harder to treat, requiring stronger or different medications. Beyond resistance, antibiotics can cause other systemic effects. These include gastrointestinal problems like nausea, diarrhea, or stomach upset. Yeast infections, especially in women, are also common because antibiotics can kill off bacteria that normally keep yeast in check. Rare but serious side effects include Clostridioides difficile infection, which causes severe diarrhea, and colitis, a dangerous inflammation of the colon. Allergic reactions are possible too, ranging from mild rashes to more severe responses. Long-term antibiotic use might also influence your immune system. Some research suggests that disrupting gut bacteria could affect how your immune system regulates itself, possibly impacting inflammation and healing processes in conditions like diverticulitis. Given these potential risks, medical guidelines now recommend using antibiotics carefully, especially in complicated diverticulitis cases. Many health authorities support a more conservative approach, sometimes even suggesting no antibiotics at all for mild cases, with close monitoring instead. The goal is to treat the infection effectively while minimizing the chance of long-term harm. Always remember, the decision to use antibiotics should be personalized. Your healthcare provider will consider your specific health situation, the severity of your diverticulitis, and other factors before recommending treatment. If you're concerned about long-term effects, discuss these with your doctor to find the best approach for your health. In summary, long-term use of antibiotics for diverticulitis can lead to disruption of your gut bacteria, increased risk of recurrence, antibiotic resistance, and other systemic side effects. Being cautious with antibiotic use and following medical advice helps protect your overall health and ensures effective treatment.